8 drinks to help reduce high cholesterol at home. 1. Green tea. Benefits. Contains catechins and antioxidants, helps reduce LDL and prevent cholesterol oxidation, protecting arteries. How to make. Mix 1 to 2 ghee of green tea leaves, or 1 tea bag, with 200 ml of hot water, 80 to 85 degrees Celsius. Soak for 3 to 5 minutes. Filter out the residue. Drink warm. You can add a few drops of fresh lemon. No sugar added. Dosage. 1 to 2 cups day, best in the morning or afternoon. Note: avoid drinking when hungry or close to bedtime because it contains caffeine. People with low blood pressure should drink less. 2. Apple juice. Benefits. Rich in pectin, soluble fiber, helps reduce cholesterol absorption in the intestines, increases HDL. How to make. Wash. 2 apples, peel, optional, cut into small pieces. Blend with 100 ml of filtered water, filter the pulp, or keep the pulp to increase fiber. Drink fresh, can add 1 slice of ginger to enhance flavor. Dosage. 1 cup, 200 ml. Day, drink 30 minutes before meals. Note: avoid adding sugar. Diabetics should choose green, less sweet apples and consult a doctor. 3. Celery juice. Benefits. Contains phthalides, which help relax blood vessels, lower blood pressure, and apigenin, which reduces LDL. How to make. Wash 2 to 3 celery stalks, chop them. Blend with 100 ml of water, add 1/2 apple or cucumber for easy drinking. Filter the pulp, drink fresh immediately after making. Dosage. 1 cup, 150-200 ml day, 3 to 4 times/week. Note: do not use if you are allergic to celery or have low blood pressure. Pregnant women should avoid high doses. 4. Ginger tea. Benefits. Gingerol in ginger helps reduce LDL, improve blood circulation, and reduce inflammation, protecting the cardiovascular system. How to make. Cut 3 to 4 slices of fresh ginger, 5g, crush. Boil with 200 ml of water for 5 minutes, let cool. Filter, add 1 teaspoon of honey, if not diabetic, and a few drops of lemon. Dosage. 1 to 2 cups day. Drink warm after meals. Note: avoid drinking too much if you have stomach problems, ulcer, reflux. Consult your doctor if taking blood thinners. 5. Carrot juice. Benefits. Rich in beta-carotene and fiber, helps reduce LDL, increase HDL, and protect arteries from oxidation. How to make. Wash 1 to 2 carrots, peel, cut into small pieces. Blend with 100 ml of water, can add 1 slice of ginger or 1/2 orange. Filter the pulp or drink the pulp to increase fiber. Dosage. 1 cup, 200 ml. Day, 4 to 5 times, week. Note: drink 2 hours apart from medication because it can affect absorption. Limit if blood sugar is high. 6. Walnut or almond milk, unsweetened. Benefits. Contains omega-3, fiber, and plant sterols, which help reduce LDL, increase HDL, and improve heart health. How to make. Soak 20-jar walnuts or almonds overnight, rinse. Blend with 200 ml warm water. Filter the pulp with a cloth bag. Drink fresh, no added sugar. Can add a little cinnamon to enhance the flavor. Dosage. 1 cup, 200 ml. Day, drink in the morning or afternoon. Note: choose whole nuts, do not roast with salt. People with nut allergies should avoid. 7. Pomegranate juice. Benefits. Rich in polyphenols and antioxidants, helps reduce LDL, prevent arterial plaque, and improve blood circulation. How to make. Separate the seeds of 1 pomegranate. Blend with 100 ml of water. Filter the pulp. Drink fresh immediately to retain nutrients. Can be diluted with water or add a few drops of lemon. Dosage: 100 and 150 ml day, 3 to 4 times/week. Note: avoid drinking too much because it can lower blood sugar. People taking cholesterol-lowering drugs, statins, should consult a doctor. 8. Artichoke tea. Benefits: contains cynarin, helps increase bile secretion, reduce LDL, and improve liver function, support cholesterol metabolism. How to make. Use 5 to 10 g's of dried artichoke flowers, or 1 tea bag, mixed with 200 milliliters of boiling water. Soak for 5 to 10 minutes, drink warm, can add 1 teaspoon of honey. Dosage: 1 to 2 cups day, drink after meals. Note: avoid if you are allergic to artichoke or have gallbladder disease. Do not drink too much because it can cause bloating. Sample cholesterol-lowering drink plan. 1 week. Days 1 to 2. Morning: 1 cup of green tea, 200 ml. Afternoon: 1 cup of apple juice, 200 ml. Days 3 to 4. Morning: 1 cup of walnut milk, 200 ml. Afternoon: 1 cup of celery juice, 150 ml. Day 5 to 6. Morning: 1 cup of ginger tea, 200 ml. Afternoon: 1 cup of pomegranate juice, 100 ml. Day 7. Morning: 1 cup of artichoke tea, 200 ml. Afternoon: 1 cup of carrot juice, 200 ml. Combination: drink enough 2 to 2.5 liters of filtered water day, eat green vegetables, fish, limit fried foods. Important note: consult your doctor. If you are taking cholesterol-lowering drugs, statins, or have underlying diseases, diabetes, low blood pressure, liver disease, you need to consult before using these drinks. Limit sugar. Do not add too much sugar or honey, especially for people with diabetes or obesity. Lifestyle combination. Diet: increase fiber, oats, beans, reduce saturated fat, animal fat, fried foods. Exercise: walk or do yoga, 30 minutes, day, 5 days, week. Reduce stress: meditate or do deep breathing for 5 to 10 minutes/day. Monitor cholesterol. Check blood lipids every 3 to 6 months to evaluate effectiveness. Do not abuse. Drink a variety of drinks. Do not use too much of one type to avoid nutritional imbalance. Abnormal signs. Stop drinking and see a doctor if you have symptoms of stomach pain, dizziness, or allergies. Thank you for watching the video. Wish you and your family happiness.